hi, I'm Sarah, and my group members were Rachel and McKenna. And this week we chose to research osteoarthritis. So to start off, what is osteoarthritis? Osteoarthritis is the most common form of arthritis that is found in your hands, your knees, your hips, and your spine. And it occurs when the protective cartilage between your joints that cushions your joints and has a nice protective layer begins to deteriorate and wear down. The more common term for this is wear and tear arthritis or degenerative joint disease. So what are some causes? First of all, some causes are if you're overweight, you don't exercise, and it can be genetic. But over time, the osteoarthritis becomes inflamed and that cartilage becomes inflamed, making your joint irritated. And then it begins to wear down. And then eventually the cartilage will break down completely, and that causes your bone to rub on another bone, which causes a lot of pain and discomfort just with everyday life. For some symptoms, the most common symptom you're going to see is just pain in joints. Just everyday movement is going to be irritated and just uncomfortable. You're also going to feel stiff. You can feel some tenderness, some loss of flexibility. And then when you're moving your body, sometimes your bones crack, like just right now when you're a normal human. But with osteoarthritis, with pretty much any type of movement, you're just going to feel that popping and cracking sensation, which makes it really uncomfortable to move. If your joints are really inflamed and swollen, they're going to be swelled with infection in them. And then also another common thing with osteoarthritis is your bones could produce extra bone spurs on the ends of your joints to kind of make up for that cartilage loss. And that extra bone spurs is going to be pretty uncomfortable and cause a lot of pain. So the picture there just illustrates some common areas of your joints where osteoarthritis is the most common. Obviously, your hips is a big one, and then in your wrists and elbows are big. So with your assessments, the doctor is just going to start with the family history because, again, it can be genetic, not super common, but it can be. And then they're going to do a physical exam and a psychosocial exam, but I'll talk more about that in the next slide. For diagnoses, so like I said, the doctors are going to start with a physical exam. And what they're going to do is the doctors are going to feel and palpate your joints in the affected area, and they're going to look for tenderness, swelling, redness, and flexibility. They also can use two different types of imaging tests. The first is an x-ray. Now, cartilage doesn't show up on an x-ray, but bones do show up on an x-ray, and if your osteoarthritis is progressed far enough, it's going to show that a bone is touching another bone, which indicates rubbing, and that also shows that the cartilage is all gone. So then that can be a way of determining osteoarthritis. They can also use an MRI, and an MRI uses radioactive waves in a strong magnetic field to produce a nice picture of your joints that shows your bones, your tissues, and your cartilage. Now you would think that using an MRI would be the most common way to diagnose osteoarthritis, but it's not. It's just another tool to help aid in your diagnosis. Because in MRIs, you can only really see it if it's super complex. So this picture on the slide shows an MRI with osteoarthritis. And you can see on this side, there's no arthritis settled in because you can see the cartilage in between here. But then on this side, you can see that there's that white line, and that indicates bone-on-bone rubbing. Another way to diagnose this is could be a blood test. The doctors are going to draw blood from you to do a complete blood count. Now, osteoarthritis is not indicated in your blood count, but the doctors use this as a way to rule out any other diseases because the symptoms can be kind of common and be the same as other symptoms. And finally, the last way they could use to diagnose this is a joint fluid analysis. This is where the doctors remove fluid from your infected joints, and they just do a blood test and culture that to make sure, again, they're not confusing this with another disease. So for treatment, there's three common ways to treat it. There's medications. For a mild to moderate case of osteoarthritis, they're just going to use over-the-counter medicine like acetaminophen or non-steroid anti-inflammatory drugs, which is also over the counter. That could be ibuprofen. And what this does, this just aids in killing the pain, and it decreases swelling. They could also use deluxetide, which is typically an antidepressant, but it's also used to reduce swelling. So that's another medication they could use. And then typically the doctors are going to suggest therapy at the start of your diagnosis, just because everyday life can be pretty painful. So physical therapy kind of teaches you how to move your body in a way that's not painful, and then occupational therapy is more lifestyle changes and how to do your everyday life with no pain. And then finally, there's surgical procedures, two of which include injections, and the last one is a complete joint replacement, which replaces the whole joint with artificial cartilage, but this is typically not advised because it can cause a lot of complications and blood clots to form. And then the two injections they use is a cortisone steroid, which is just essentially a numbing shot, and it numbs it for a couple of weeks. And then a lubrication injection injects hyaluronic acid, which cushions your joint and acts as like mock cartilage. And then finally, for prognosis and follow-up, osteoarthritis is typically not a fatal illness, but it does progress over time if you don't treat it carefully and understand the symptoms right away. So when you get diagnosed with it, it's important that you make complete lifestyle changes, such as if you're overweight, it's important to start exercising and to lose that weight. And then again, you can go to movement therapies or physical therapies to learn how to do everyday life more comfortably. Doctors will also advise that you apply heat or cold pressure to your affected joints, because this is a non-medication way to reduce your pain. And then finally, they could prescribe a brace or shoe insert just to keep that joint stable and not doing some crazy movements. And these are our sources.